Welcome to Farrago's federal election coverage for 2019. I'm Lucy Williams and I'll be taking you through a health policy explainer. Welcome to Farrago's federal election coverage for 2019. Just a little disclaimer to begin. We are just focusing on the Liberal and Labor policies, but check out the policies of minority parties that you're considering voting for. Also, I am not aligned with any party, and nor is Farrago, although some of our reporters may be members of a party, but this will be declared in any coverage that's affected. Also, please note, Labor costings were not released at the time of recording, and thus some of the policy points may seem less developed. So definitely recommend you check those out when you have the time. So let's get into an explainer of the health policies of the two major parties. So firstly, the Liberal Party. The Liberal Party's website actually goes into quite significant detail on their health policies, but I've summarised these into three broad categories. So firstly, fighting the scourge of drugs. Second, better healthcare, which is an incredibly broad topic, but I'll get into that in a little bit. And then third, supporting people with disability. So the first policy is fighting the scourge of drugs, and the Liberal government calls this the drugs menace. So fairly evident anti-drug policy. Some of the ways they're going to achieve this fight are through tougher law enforcement and also treatment and support programs for addicts, international partnerships with other countries to fight trafficking. They specifically mentioned partnerships with countries like China to fight trafficking, and then $450 million to help fight the impact of ICE specifically, and then drugs testing for New Start and Youth Allowance recipients. Notably, Labor are blocking this in the Senate. The Liberals then go on to explain their second policy point, which is better healthcare, which, as it sounds, is incredibly broad. Some of the key elements of this policy that I've noted are the 5-year public hospital agreement that will deliver $31 billion more funding for hospitals, $1.25 billion community health and hospitals program that will improve healthcare specialist services, including cancer treatment, drug and alcohol treatment, preventative, primary and chronic disease management, and mental health care. The Medicare Guarantee Act guarantees Medicare and pharmaceutical benefits scheme, according to the Liberal government. We'll discuss the Labor Party's view on this in a bit. And then $375 million investment in over 50 new MRI licenses around the country. Liberals are also proposing more affordable private health insurance, contributing to medical research through the Future Fund, increasing mental health funding to $4.8 billion this year. They're also promising an additional 30 headspace services by 2021 and new specialist residential facilities for eating disorders. The $503.1 million Youth Mental Health and Suicide Prevention Plan is the largest suicide prevention strategy in Australia's history, and they're also contributing $550 million towards a stronger rural health strategy. And Liberals' third major health policy area is supporting people with disability. So to achieve this goal, they're contributing $29 billion for students with a disability from 2018 to 2029, $45 million to develop a national disability information gateway, which will include a website and a 1-800 number to assist people in finding services that are applicable to them. the introduction of a new 7% employment target for people with disability across the Australian Public Service by 2025, and providing $2 million to support people with autism in finding and keeping a job. Interestingly, their plan for the NDIS has been criticised as an underspend, but we will discuss this slightly later in the Labor policy coverage. So now on to Labor's policies. So now onto the Labor policy priorities. Just before I get into that, please note that the Labor costings were not yet released when we recorded this. Also, a lot of the Labor policy is framed as oppositional to Liberal policy. So it's not so much me saying this is what the Liberals are doing wrong, rather how Labor has framed their policy positions on their website, and most of them are focused on what, in Labor's opinion, the current coalition government is doing wrong. So saying that, let's get into the priority areas. So firstly, opposing Liberal cuts. Secondly, NDIS. 3, saving Medicare. And 4, fixing hospitals. So let's get into it. So we're beginning with opposing Liberal cuts. Some of the cuts that Labor are particularly opposing are the dental cuts that the Liberal government has proposed. Labor has said that over 300,000 disadvantaged Australians will miss out on critical dental care every year because of these cuts. They also said that as Treasurer, Scott Morrison cut funding from health, which included $700 million from public hospitals, included the cutting of Medicare, freezing of rebates, and increasing out-of-pocket costs for visiting your local doctor or specialist, and approved private health insurance premium increases, which cost families more than $1,000 extra each year for coverage. So second was the NDIS, the National Disability Insurance Scheme. So the Labor Party is ensuring $22 billion to make sure that this scheme is fully funded. And as I discussed earlier, they have attacked the coalition's management of the NDIS and particularly criticised their budget announcement, which proposed a $1.6 billion underspend and said that it deprived the scheme of funds it desperately needed. Thirdly, Labor want to save Medicare. So obviously, as we discussed before, the Liberals have promised that Medicare is safe. However, Labor do not believe this. They've outlined how in their first budget the Liberals tried to impose a GP tax, also tried to slash the Medicare safety net, and tried to increase PBS co-payments. They also point out that Scott Morrison, when he became Treasurer, continued his attack on Medicare and detail this as they extended the Medicare freeze to 6 years, which cut $3 billion from Medicare, attempted to abolish Medicare bulk billing incentives for tests and scans, and tried to abolish the child dental benefit scheme, all of which Labor believe indicates that Medicare is not necessarily safe. And the final Labor health priority that I've noted is to fix hospitals. Again, fairly broad and positioned as oppositional to the Liberal policy, but they have outlined the cuts that they oppose. So specifically, Labor opposes Scott Morrison's cut of $715 million from Australia's hospitals during his time as Treasurer, and they additionally oppose his plans to cut a further $2.8 billion for public hospitals as Prime Minister if he is re-elected. So I hope that gave you a little bit more understanding of the health policies that are key in this election. Thanks for tuning in. Keep an eye out for more Farrago coverage and make sure your vote counts. This video was produced on Wurundjeri land, a key member of the Kulin Nations. We pass our respects on to the Wurundjeri elders, both past and present, and acknowledge that the land we are on was never ceded.